Welcome back to the podcast, where we explore the systemic barriers shaping health outcomes and uncover actionable solutions for creating a fairer healthcare system. Today, we're diving into the powerful, often invisible forces that shape our health outside the doctor's office. These forces are called social determinants of health, and they have a bigger impact on how healthy we are than many people realise.
Imagine two families living in the same city, but in different neighborhoods. One has access to clean parks, high-performing schools, and a grocery store filled with fresh fruits and vegetables. The other lives in a community with rundown housing, underfunded schools, and only fast food options. Despite living just a few miles apart, these families will likely experience vastly different health outcomes. The reason is simple but profound. The conditions in which we live shape the opportunities we have, which in turn affect how healthy we are. Social determinants of health are the non-medical factors that influence our health outcomes. They include things like income, education, housing, transportation, and access to nutritious food. Studies have shown that these factors account for as much as 80% of health outcomes. This means that where you live, the opportunities available to you, and the conditions you face daily matter more than the medical care you receive. Economic stability is one of the most significant determinants of health. Families facing financial struggles often encounter impossible choices, such as whether to pay for medication or buy groceries. Stable, well-paying jobs provide not just income, but benefits like health insurance and paid leave. Without these safety nets, individuals might delay seeking care or skip necessary treatments, which can lead to worsening health over time. Imagine trying to manage a chronic illness like diabetes while working a low-wage job with no sick leave. Every decision about health becomes a trade-off, and the consequences can be life-threatening. Education also plays a key role. People with higher levels of education tend to earn more, access better healthcare, and have greater health literacy. They are more likely to understand and follow medical instructions and manage chronic conditions effectively. But in neighborhoods with underfunded schools, students often miss out on these opportunities, limiting their future earning potential and increasing their risk of poverty-related health challenges. Housing is another critical factor. Poor housing conditions, such as mold, pests, or lead paint, can lead to serious health issues, including asthma and developmental delays in children. Overcrowding and unstable living situations increase stress, which weakens the immune system and makes people more vulnerable to illness. For families experiencing homelessness, the risks multiply as they face exposure to unsafe environments and a lack of basic resources like clean water and sanitation. Access to food is another determinant that has a profound impact on health. In many low-income areas, fresh, nutritious food is simply unavailable. These neighborhoods, known as food deserts, force residents to rely on cheap, processed options that lead to higher rates of obesity, diabetes, and heart disease. Research has shown that individuals living in food deserts are significantly more likely to develop diet-related illnesses than those with access to healthy options. Even transportation can determine whether someone gets the care they need. In rural areas, the nearest clinic or hospital might be hours away, making it difficult to access regular care. In urban centers, transportation costs or long travel times can discourage people from keeping appointments. For many, seeking medical care isn't just inconvenient, it's nearly impossible. The reality is that social determinants of health don't affect everyone equally. Marginalized communities, including people of color, low-income families, and rural populations, often face the greatest barriers. Black and Hispanic households experience food insecurity at nearly double the rate of white households. Native American communities frequently lack access to clean drinking water due to neglected infrastructure. Rural residents face unique challenges like transportation barriers and limited healthcare facilities. These disparities are not accidents. They're the result of policies and practices that have systematically excluded certain groups from resources and opportunities over generations. The good news is that these problems are solvable. Community-based initiatives are making a difference by addressing the root causes of health inequities. For example, urban gardening programs are turning vacant lots into spaces where residents can grow fresh produce, improving access to healthy food, while building stronger communities. Neighborhood health hubs are another example of innovation. These hubs combine medical care with services like job training, housing assistance, and nutrition education, empowering individuals to address multiple needs in one location. Policy changes can also have a lasting impact. Expanding Medicaid helps low-income families afford healthcare, while raising the minimum wage reduces financial stress and improves access to basic necessities like housing and food. Partnerships between healthcare providers and local organizations can address barriers like transportation, offering shuttle services or telehealth options to ensure that no one is left behind. Addressing social determinants of health requires collaboration across sectors. Hospitals, schools, community organizations, and local governments must work together to design solutions that meet the specific needs of their populations. Using data to identify at-risk neighborhoods and measure the success of interventions ensures that resources are directed where they are most needed. Being healthy is about more than medical care. It's about having access to safe housing, nutritious food, quality education, and stable employment. These are the building blocks of health equity. By addressing social determinants, we can create environments that allow everyone to thrive, regardless of their background or circumstances. The journey to health equity starts with recognizing that health is shaped not just by biology or behavior, but by the conditions in which people live. It's about creating opportunities and removing barriers so that everyone has a fair shot at living a healthy, fulfilling life.
In the next episode, we'll take a closer look at racial and ethnic disparities in healthcare and how systemic racism continues to affect health outcomes. Thank you for listening, and let's keep working together to build a healthier, fairer world for all.